everyone, we are finally back with your free consult after a long break. I'm so excited to do so many new episodes for you. This is a topic that a lot of you have been asking me about and DMing me about. It's on pelvic organ prolapse, and I hope you enjoy it. So first of all, it's most important to us to understand what exactly is pelvic organ prolapse. And that's when the uterus and the cervix start to drop slowly into the vagina. Sometimes it could be even the top of the vagina dropping down into itself, and that's basically what constitutes pelvic organ prolapse. So now we need to understand what are some of the causes of pelvic organ prolapse. The major cause of pelvic organ prolapse is actually vaginal delivery. So during labor and delivery, there's a lot of stress on the pelvic floor muscles, on the tissues, on the nerves, on the ligaments, and it makes them stretch and become weak, so the uterus can drop and start to fall into the vagina. But there are many other causes for pelvic organ prolapse. For example, our upright posture, where all our abdominal organs tend to make the uterus start to drop into the vagina. Our inclination of our pelvis at 45 degrees can also just make the uterus start to drop into the vagina. Women who are obese are more predisposed to pelvic organ prolapse because of the weight of their intra-abdominal organs. In menopause, we get a lot of estrogen drop, and that could also make the ligaments weak, the pelvic floor muscles weak, and so the uterus starts to drop once again. There are some women who have genetic abnormalities where they don't form collagen very well, and so their ligaments tend to be weak, their muscles tend to be weak, and once again the uterus can start to drop into the vagina. Women who have jobs that cause a lot of heavy lifting, or maybe they do that for health purposes, women who lift a lot of weights could cause themselves to have pelvic organ prolapse. Women who have a heavy uterus because they have fibroids or they have adenomyosis can make that uterus definitely start to drop into the vagina. So what are some of the types of pelvic organ prolapse? Pelvic organ prolapse can generally be either uterine or vaginal. And when we talk about vaginal pelvic organ prolapse, there could be several organs that could prolapse into the vagina. We could have the bladder dropping into the vagina a little bit, that's called a cystocele. We could have the urethra drop into the vagina, which is called a urethrocoele, and this can actually be seen by your gynecologist when they examine you. We could have something called an enterocele, where the very top of the vagina, or the upper third of the vagina, pushes itself up into the vagina from the rectum. We could have a rectocele, where the entire rectum actually pushes itself up into the vagina, and that's called a rectocele, and these are weaknesses in some of the walls of the vagina. We could have the very top of the vagina, which is called the vault, prolapse down into the vagina as well. And lastly, we could have the opening of the vagina open up. It's called a relaxed perineum, and this could also be a form of pelvic organ prolapse. So what are some of the symptoms of pelvic organ prolapse? Sometimes women get a mass that they can feel passing out of their vagina, and sometimes coming out completely into the vagina, and this is one of the major symptoms of pelvic organ prolapse. Women could also have painful sexual intercourse. They could have urinary symptoms such as frequent urination, or feeling like their bladder isn't completely empty, or pain during passing urine, or frequent urinary tract infections. Women could also have rectal symptoms such as the feeling of incomplete emptying of the bowels, constant constipation, and this could really make them quite uncomfortable. Some women are even able to push their uteruses up with their own fingers back into the pelvis, and this is really when they have a later stage of pelvic organ prolapse, for example grade 3 or 4, which we're gonna get into in just a minute. Some women get chronic, dull, lower back pain. Some women get pelvic pain on a very regular basis, and a last group of women tend to get even ulcers on the part of the cervix of the vagina that has actually come out of the vagina, and all these symptoms can be quite disturbing and form part of pelvic organ prolapse. So pelvic organ prolapse is usually examined by your OBGYN, and they're able to diagnose it and tell you that yes, you actually do have pelvic organ prolapse, and there's different degrees to this, and we usually classify them from the 1st to the 4th degree, where the 1st degree is a very mild drop into the vagina, and the 4th degree is when the entire uterus can actually drop out of the vagina following several normal deliveries or some of the reasons that we've discussed before. Now, what are some of the measures that we can use to prevent pelvic organ prolapse from happening? And we usually like to do this during your antenatal visits, during your delivery, and even postnatally. So during the antenatal visits, you'll be asked to do lots of Kegel exercises, and you'll be asked to prevent constipation, because these two will help you not to get a pelvic organ prolapse. And during your labor and delivery, especially if it's a normal or vaginal delivery, your gynecologist has to ensure that your pelvic floor muscles are very well supported, so that eventually they do not become stretched out and weak to the point that your pelvis has to actually release the uterus and drop out of it. In your postnatal care, you'll be asked to do lots of Kegel exercises to be able to prevent pelvic organ prolapse from happening. Now, we also have conservative measures to be able to treat pelvic organ prolapse. And remember, these are measures for women who are unwilling to have surgery, or women who are unfit to have surgery, or women who are waiting to have a surgery. And most of the time, this involves having a pessary. This is a silicone ring that's inserted into the vagina to be able to keep the uterus up and prevent it from falling down. And this is a conservative measure for treating pelvic organ prolapse. And lastly, we have surgical measures at which we treat pelvic organ prolapse, mostly reserved for women where the pelvic organ prolapse is really severe and now it just has to be sorted out surgically. And for surgery, we have very many different options. I'm briefly going to mention 6 options that we have for surgery. One of them is called anterior colporrhaphy. This is where we repair the anterior wall of the vagina, or the top wall of the vagina, where it comes into contact with the bladder and the urethra. Once it's repaired, we're able to repair what we call a cystocele and a urethrosil, so that the bladder and the urethra stop dropping into the vagina. We also have posterior colporrhaphy, where we prevent the rectum, or we treat the rectum that has now popped up into the vagina. We surgically repair it so that it can go back down. We also have what we call colpopexy, which is where we suspend the uterus into the walls of the pelvis. We can either suspend it to the backbone or the sacrum, or to the sacrospinous ligament, which is the ligament that attaches the uterus to the sacrum or the backbone. So it can literally be suspended and pulled up and attached into the pelvis. We also have cervicopexy, where we suspend or lift up the cervix to be able to suspend it back into the pelvis. One of the other options to surgically treat this condition is just to remove the entire uterus through the vagina, which is what we call a vaginal hysterectomy. And this is a more or less permanent solution, because the uterus will stop dropping, because it will actually not be in the pelvis any longer. One of the cosmetic gynecology solutions to this problem is to do a procedure called a vaginal perineoplasty, where we do a vaginal tightening and we repair the entrance of the vagina for women who have a relaxed perineum, which, if you remember, as we mentioned, is a type of pelvic organ prolapse. So these are your options, ladies, if you have pelvic organ prolapse. Don't be ashamed of it. It's very treatable. Many women don't like to talk about it. Many women suffer through the pain of sexual intercourse and the shame of the symptoms. Bring it out to your OBGYN and you could have a number of solutions available for you. I hope you enjoyed today's episode and that you understand more about pelvic organ prolapse, and we'll see you next Thursday on your free consult.